Hi, my name is Andrew, and I'm 11.
I'm Liam, and I'm 11 as well. And we're going to be talking to my mom about what she does.
Hi, my name is Dr. Andrea Shields, and I'm a maternal fetal medicine specialist here at the Children's Hospital of San Antonio. And today I'm going to be talking about my research.
What kind of research do you do?
I study complications in women with gestational diabetes who are pregnant.
What is diabetes?
So diabetes is a condition that some people have where they have a hard time processing their blood sugar. So like when you and I eat a banana, the banana breaks down in our body into sugar. And we make something called insulin that's able to take that blood sugar out of our blood and into our cells. Unfortunately, people with diabetes don't have it so easy. They make insulin, but sometimes it doesn't work well for them, or sometimes they just don't make enough insulin, so their average blood sugar level is higher than ours. And over time, that can cause damage to internal organs, like the eyes and the kidneys.
What is gestational diabetes?
Gestational diabetes is diabetes that is diagnosed during pregnancy. And gestational diabetes can cause a lot of complications in pregnancy, including issues with high blood pressure, issues with growth abnormalities in the fetus, early delivery, and newborn complications, where fetuses sometimes end up in the newborn nursery due to trauma or problems controlling their own blood sugars.
What is your study looking at?
So I'm going to be looking at how we can optimize nutrition in women with gestational diabetes. In the United States, there's about 8% of pregnant women who are diagnosed with gestational diabetes. And unfortunately, here in Texas, and specifically in San Antonio, that rate is even higher. So I'm looking at how we can help them control their blood sugars better and hopefully get better outcomes.
How is your study designed?
So I'm doing something called a randomized controlled trial. And what that is that we enroll women into our study and then we place them in two different groups. The first group is what we call a control group. And a control group is a group of women that we can compare to the study group that basically receive the same care that they would get whether they were in our study or not. So what the control group will get is routine care consisting of counseling around how they should change their diet to control their blood sugars, as well as education on how they monitor their blood sugars at home. So we actually have them poke their finger, the tip of their finger, to get a blood sample so that they can measure their blood sugar at home 4 times a day. And then they bring those blood sugars to me and I can review them and tell them whether they're doing a good job or whether they have to make some changes with their diet. And sometimes even we have to start them on treatment called insulin. And so they have to give themselves insulin injections, sometimes several times a day to control their blood sugars. That's the control group. For the study group, this is a group of women that we actually will be doing an intervention on. And what we'll be doing with our intervention is we're having them go to classes here at the Chef Kitchen, which stands for the Culinary Health Education for Families. And they'll be getting taught by some of our chefs here on how to prepare a healthy meal, specifically meals that are good for women with gestational diabetes and will lower their blood sugars.
How do you know which woman goes to which class?
So we're using a technique called randomization. So you can think of randomization like flipping a coin. So we'll flip a coin and let's say it lands on heads, we'll put them in the control group. If it lands on tails, we'll put them in the study group. And we do this because we want to reduce the risk of bias. And we don't want bias in the study because it can actually change the outcomes. So we want the most honest, fair outcomes in the study, and so that's why we use this technique.
What do they learn in the Chef Kitchen?
So my patients who go to the Chef Kitchen are being taught by chefs, culinary trained chefs, on meal preparation and good foods to focus on to try to control their blood sugars better during pregnancy. So for example, Liam, do you think that this is a nutritious meal in front of us? There's a hot dog, some corn, and some pasta and chocolate milk.
No.
No, that's not very nutritious because it has a lot of starchy food, a lot of processed high salt food. And if my patients with gestational diabetes were to eat a meal like that, their blood sugar would be super high after the meal. So what the chefs are teaching my patients is how to make food substitutions so that they can have more nutritious meals. And so you can see on the far end there, we have a meal that is much more balanced and has foods with what we call a lower glycemic index. So it's not going to cause the blood sugar spikes that you would see with a high starch meal. So things like carrots, a pear, some wheat bread, and baked chicken, as well as substituting the chocolate milk for regular milk. The other thing that we're providing our patients at the Chef Kitchen is this customized Chef Recipe for Life book. And so this was a recipe book that we created specifically for women with gestational diabetes. And it has over 100 recipes for breakfast, lunch, and dinner snacks. And it has cooking tips, and it also says what kind of nutrients are in each food that's in those recipes.
What other things does your study look into?
So the other thing that our study is looking at is whether or not these women have nutritional deficiencies, things like vitamin D deficiency, so that we can treat that during pregnancy. And we're treating it both with supplementation that we give them, but also through the foods that they eat. So for example, salmon is very high in vitamin D and can help them increase their levels.
What are you hoping to learn in your study?
So we're hoping to find out if these changes that we make to a woman's diet by more education around nutrition will actually impact pregnancy outcomes. So hopefully what we'll find is that it improves pregnancy outcomes for the mom and for her newborn.
Thanks, Mom. Thank you for watching. That's all the questions we have. Now let's go play some Fortnite.